Hello, my name is Jennifer Bates, and I'm here today to speak to you about the brain injuries in small children and share some facts. According to the Center for Head Injury Services, there are 2 million traumatic brain injuries each year. That's 1 every 15 seconds. 500,000 of these require hospital admission, and every 5 minutes someone dies from a head injury. 140,000 each year. 75,000 to 100,000 in the U.S. Over half of the deaths occur at the time of the incident or within 2 hours of being hospitalized. Every 5 minutes, someone becomes permanently disabled due to a head injury. 70,000 to 90,000 of those survive and will have long life disabilities. 2,000 more will live in a persistent veggie state. Over 50% of those who sustain a brain injury were drunk at the time of the injury. The cost of traumatic brain injuries in the U.S. is over $48 billion each year. Some of the causes of brain injuries: 51% is car accidents, 21% is falls, 12% is assaults or violence, 10% is sports or recreation, 6% is other, like Tripp Halstead. Survivors: a majority of head injury survivors are under the age of 30. 2/3 of those will survive, live a normal lifespan, but will require long life services such as vocational rehab and physical therapy. Injury: a person doesn't need to be knocked out or lose consciousness to have sustained a traumatic brain injury. A person does not need to be striked in the head to sustain a traumatic brain injury. Even mild traumatic brain injuries can cause cognitive impairments that can impact a person's ability to work or earn a living. People who sustain a brain injury are 3 times likely to sustain a second brain injury. Those who sustain a second brain injury are likely to sustain the third brain injury. Bicycling: 75% of all bicyclists who die from head injuries. 85% of brain injuries on a bicycle accidents can have been prevented by wearing a helmet. Demographics: males between the ages of 14 and 24 have the highest rate of injury. Males are almost twice as likely to suffer serious brain injuries than females. Brain injuries kill more Americans under the age of 34 than all other combined diseases. Brain injuries in children: child abuse is the cause of 64% of all infant head injuries. Approximately 1 in 500 school-aged children each year receive a head injury severe enough to be hospitalized. 1 million children sustain a brain injury each year. 1 in 10 of those children hospitalized will suffer moderate to severe impairments. Traumatic brain injury is the leading cause of death for children and young adults. I have been following this 2-year-old little boy by the name of Tripp Halstead on Facebook since November the 22nd of 2012. On Monday, October the 29th, 2012, life as Bill and Stacy Halstead knew it would never be the same. Their son Tripp was outside playing at daycare, and a large limb fell out of the tree and hit him in his head, crushing his tiny skull to many pieces. He was rushed to the nearby hospital and then flew to Eagleston Children's Hospital. Doctors told his parents to say the goodbyes, not expecting Tripp to live. He came through the first surgery within the next 24 hours, then to Friday, November the 2nd, and now at 132 days later, he is proving the doctors wrong. Tripp has suffered some terrible bouts of infection, pain, and storms. Storm and brain injury patients make the body stiff and hard to manage. When the body storms, this includes a temperature of 38.5 degrees Celsius, hypertension, a pulse rate at least 130 beats per minute, a respiratory rate of at least 40 beats per minute, profuse sweating, and dystonia, rigidity of the body. And it will last for up to 3 days and have 1 cycle per day. The posturing is abnormal body posture indicated by rigid extension of the arms and legs, downward pointing of the toes, and backward arching of the head. Not all the symptoms may occur during storming. The cause of storming has just been recently understood due to the symptoms. The first theories were that the storm was caused by the epilepsy-type electrical discharge within the brain. However, current understanding is that it is due to the dysregulation of the autonomic nervous system due to injury of one or more parts of the brain. Also, in both children and adults with brain injuries, become air trapped under pressure in the intracranial space, usually been when the brain did not expand following the removal of the chronic subdural clot, and also post-trauma when there is traumatic air without an overt of CSF leakage. Tension has been reported following silent otitis media, spinal trapping in a patient with a basal skull fracture. Other known but rare causes of this tension is scuba diving. As of Saturday, March the 9th, 2012, Tripp's CSF fluid was bacteria-free. That is great news. Let's pray that it stays that way. For more information, you can read up on these sites. Facebook, Tripp Halstead updates, www.teamboomfortripp.com, Tripp Halstead updates at gmail.com, www.headinjurycenters, www.prayforaiden.com, and www.agns@pans.org. Thank you and have a blessed day until we meet again.